Topping the news tonight, the Pan American Health Organization commending health officials for its management and response to the COVID-19 outbreak. However, P.A.H.O's country representative says if residents want to be free of the mandatory national lockdowns, greater compliance is necessary. Jimmy Swain tells us more.
COVID-19 cases in the country are well into the triple digits, and the fear of health services being overwhelmed remains. Country representative for the Pan American Health Organization, Dr. P.A.H.O, reiterating why lockdowns are crucial to slowing the spread.
Unfortunately, we have very limited choices for this virus. If we interrupt transmission totally, which would be a situation in which the lockdown leads to no new cases being reported through the surveillance system, and with the understanding that ill persons and exposed persons have come forward for testing, then we resume our normal life.
At last count, COVID-19 confirmed cases were almost at 1,000. Dr. P.A.H.O says there is probably one thing that can end the cycle of infection and lockdowns.
Is if we are fortunate enough to have a cure identified or a vaccine available for distribution to prevent transmission. Our options for controlling the spread are quite limited, and the lockdowns are not meant to frustrate the public or to force us to interact with people with whom we do not want to interact. The lockdowns are to slow things down so that we do not overwhelm our health services.
That's an area of concern as voiced by the competent authority from the onset of the COVID-19 outbreak in March. The Prime Minister recently announced that Superclubs Breezes has been identified as the national response facility to address COVID-19.
There is still a concern that we do not have sufficient capacity for intensive care and serious cases that require oxygen and so on. Though the opportunities at Malia for the contact tracing and Breezes for the milder cases will allow us to care for larger numbers of persons who are having mild infections or infections that do not require serious hospitalized attention. But there is still concern about ICU capacity.
There is some movement on developing a vaccine, but it will take some time.
Now it's over 200 vaccines under development. And let us be realistic about the vaccines. Even with other vaccines for other infectious diseases, just because you attempt to develop one doesn't mean it would be successful. And research suggests that only 10% of candidate vaccines actually end up being effective enough to be offered to the population.
She maintains that the COVID-19 outbreak is manageable if people heed to prevention measures in order to avoid getting infected. Health officials say wearing a mask, practicing social distancing, and proper hand sanitization are among the most effective methods. Jimmy Swain, ZNS Network News.